Hello, my name is Deborah Workey, and I'll be presenting my BSc in Capstone project for the Midwestern State University BSN program. The title of my project is A Bundled Approach to Prevent Falls in Geriatric Hospital Patients After Discharge. So what are the objectives for this presentation? Identify fall prevention bundle, identify how a bundled approach prevents falls in geriatric patients after discharge, identify strategies to implement a bundled approach, identify how to prevent falls after discharge. So what is the purpose of this project? Uh, the majority of falls happen at homes, and which are common in patients 65 and above 65, and these falls are preventable. And according to CDC, among 606,392 discharged geriatric patients, 4.7% fall within 12 months after discharge. So the purpose is to decrease hospital admissions and readmissions due to fall in geriatric patients. A bundled approach has been linked with a reduction in patient falls in patient settings. However, this bundle should also include interventions after hospital discharge. According to research, over 30% of individuals who are the age of 65 and above 65 fall each year. This percentage increases to around 40% in individuals aged 85 and above. And as I mentioned earlier, falls are preventable. So what is the background and significance? It's important to know that a successful fall prevention program can improve patient safety, increase patient satisfaction, and lead to more effective geriatric care. CDC mentions that each year almost 1 million patients experience fall during hospital admissions, which 25% of falls resulting in injury and 10% resulting in serious injuries. So hospital falls among elderly patients have grown recently, and then CDC mentions that once a patient falls, they're at risk to fall again at home after discharge. So several factors might cause for geriatric patients to fall at home, which includes illness, visual problems, gait and mobility problems, polypharmacy, or the use of several medications, and so on. So this bundled approach after discharge is crucial to decrease the readmission to hospitals due to fall. What is the problem statement? In geriatric hospital patients, how does the implementation of a bundled approach compared to a standard fall precautions reduce falls after discharge? So standard fall precaution includes evaluating the patient's fall risk at the time of admission, teaching caregivers and patients about fall risks, and then ensuring a space free of clutter. And this approach doesn't help geriatric patients after discharge because a standard fall precaution is only limited to inpatient settings. But however, a bundled approach may include comprehensive fall risk assessment, multidisciplinary care team involvement, patient and caregiver education, medication assessment, and regular monitoring and follow-up. So this should be applied not just in patient settings, but a bundled approach or the tailored approach should also be applied after discharge, especially regular monitoring, creating home floor plans, and then follow-ups. For my literature review, most of the articles are peer-reviewed study and journals. So some of the studies that that were done or that are mentioned in this project include, like, a study that was published in 2024 mentions how a comprehensive fall prevention program was more effective than the conventional methods. A bundled approach that increases or a bundled approach that involves increased patient awareness and engagement through patient education, uh, and then improved environment safety has reduced the rate of falls in geriatric patients after discharge. And then another study was done in 2022, and then this study was conducted among individuals that are at the age of 65 or above at 5 acute care hospitals who were admitted to the orthopedic ward. The first group of individuals received a bundled approach or a tailored education program using home floor plans, and the second group received just the usual care such as exercise to prevent falls. The effect of a tailored fall prevention program was investigated in the discharge patients, and studies show that how the tailored fall intervention program in multiple facilities was effective against falls and near falls during the 1 month follow-up. So a bundled approach is crucial for patients, especially for high fall risk patients after discharge, because they have a high percentage of falling again and readmitting to hospital due to falls. Another article that was published in 2024 mentions how follow-up visits incorporated with a home risk assessment it reduces fall risks at home, and interventions that can be included are social visits after discharge, and then providing a logbook to track exercises. And this kind of interventions can be implemented after discharge, and also involving, another study shows that involving multidisciplinary teams like a physical therapist for mobility and gait exercises at home, social workers and physicians, how it's essential to include all these teams in the plan of fall prevention. Another article that was published in 2025 mentions how fall prevention is a complex multidisciplinary problem that calls for a customized strategy that meets patient demands. Since the cause of falls are complex, successful fall prevention strategies must be proactive, individualized, and engaged both healthcare professionals and the patient and their families and their caregivers. So who are the stakeholders in this project plan? So the main focus is on geriatric patients, and their caregivers or families, and then the nurses and nurse managers, because their direct involvement in providing care, and then other healthcare providers. This project is going to be implemented first by proposing this proposal to nurses and educators and unit managers to see what the limitations are and the things that needs to be improved. And then next, a team of healthcare professionals, including social workers, physical therapists, and physicians, are assembled to provide education how to approach this fall prevention after discharge. What should be included in this plan, in this bundle approach, especially for high fall risks, right? What kind of education? Safety education for patients and for caregivers. A comprehensive assessment of what kind of medications they're using, because some medications some medications cause fall. And then trainings include how to implement specific interventions like sensors to prevent falls, conducting, as I mentioned, conducting a comprehensive medication assessment. And then some of the barriers include finance, because the costs are high, resources, and staffings. So some of the patients might not be financially stable or might not have insurance to have PT come to their home and then perform exercises, or have a physician, or to do a follow-up, right? Or their insurance might not cover a phone health assessment, right? So some of the finance costs, and then staffing, right? As we know, like, staffing is a big deal in the hospitals too. So staffing would also be one of the barriers. So according to my interview, um, a bundled approach is more effective than a standard fall prevention, because standard fall prevention has some gaps, like insufficient screenings, not involving caregivers or families or other multidisciplinary teams, and not having customized home fall prevention plan, uh, especially for patients who are high fall risks, right? Um, so a bundled fall prevention, including all these multidisciplinaries, uh, should be uh, implemented. Evaluation, well, I expect both fall rate and admission rate to fall, to reduce significantly. Qualitative and quantitative data would be collected, such as weekly logs, right? Nurses can use this, physicians, PTs, or social workers, even geriatric patients or caregivers can use this. First, a baseline data would be recorded before implementing this approach, and then after 6 months, the effectiveness of this approach would be measured. Clinical data should also be considered, like the length of hospital stay, medication, the use of medications, and functional status. Feedback from patients and caregivers would also be collected using surveys, questionnaires, to measure the effectiveness of this bundled approach. Um, so this proposal is going to be disseminated utilizing nursing journals and then nursing workshops. This project is going to be presented at the staff meetings and huddles in order to reach a larger audience. These projects can be presented at nursing conferences, using social media platforms, also attending local health fairs, workshops, and then holding trainings at local hospitals. So the evaluation would be every 6 months. So arrange a post-discharge follow-up and home safety evaluation every 6 months. Patient outcomes can be measured before and after implementation, and the time frame for this will be a 6 month period. And then after that 6 month period, the impact of this proposal should be discussed. What needs to be improved, why this plan is not being, if it's not effective, this should be discussed, why it's not effective, what needs to be changed to be more effective, and then if it's effective, then what needs to be added to make it more effective. So and then some of the barriers might include functional status, and then living status. Some of these patients, they might have some some cognitive issues, so it might be hard to get an accurate baseline data. So these are some of the barriers that are included. Thank you. Thank you all so much for listening to my presentation. I hope you all enjoyed this. Thank you.